Nice to see you there, Daniel. And so this leads us nicely to our speaker today, Professor Laura Gray. Welcome, Laura. It's really lovely to have you here today. Just remembering before I go any further, we're recording this, so please, if you prefer to turn off your cameras, please go ahead. But yeah, welcome, Laura. Professor Gray, she's at the University of Leicester, a professor of medical statistics. Laura has a portfolio of cross-disciplinary research that spans methodological and clinical areas, and mostly in the clinical field of identification, prevention, management of long-term and multiple long-term conditions. Laura's methodological research is driven by the practical problems she encounters in her applied work, with a particular focus on prognostic models, clinical trials, and evidence synthesis. And she's also passionate about conducting meaningful PPI to inform her methodological research, and that is what she's going to speak to us about today. So Laura is also the head of Leicester's PPI-SMART group. That's PPI for Statistical, Methodology and Research Techniques. And we're really happy she's speaking to us. As often, we sense that methodologists can be left a bit behind or at the back in PPI activities. And I'm sure there's those of us from other areas other than statistics, like health informatics, can draw some inspiration from Laura's work. So with that, over to you, Laura. We're really looking forward to this.
Thanks, Jude. That was great. Thanks for that kind introduction. And thank you for inviting me to talk. And I should say a disclaimer at the start of what I'm going to present really reflects our group's work, not just work that I've done. And it really has been a group effort. But I will tell you more about that as we go. So I hope I'm preaching to the converted and that most of you will know what PPI, patient and public involvement, is. But just to make sure we're all on the same page. So we're thinking about research that is done with or by members of the public, not just research that includes members of the public as participants. So this is about having members of the public as active members of the research team, rather than just participating in the research. And you might see different terms bandied around. So participation, that's being a member, being a research subject, a participant of a research study, and that's not what we're talking about today. Engagement is around disseminating information and research findings, and sometimes you'll see the acronym PPIE, and the E is for engagement, and that's around sharing our research findings. But what I'm going to concentrate on today is this involvement piece. So this is that active partnership between us, members of the public, patients, carers, that really has an impact on the research that we're doing. So when can PPI happen? Well, at any point of the research process. I'm involved in lots of grant funding panels, particularly with the NIHR, and there's always members of the public sat on those panels, even for statistical methodology research. So it is really important that we're making sure that our research is understandable, at least the plain English summary, to a wide audience. But members of the public can be involved at all times during that research cycle. And this is true for applied health research, but also statistical methodology that I'm focusing on today. And why might we want to do this? So the first reason is sort of democratic principles. Much of our research is funded through taxpayers' money. So why shouldn't they have a say on how that money gets spent? Members of the public provide a different perspective. Sometimes as statistical methodologists, we're working within a particular disease area, not always, but likely we don't have actual lived experience of that disease area. So members of the public can really fill a gap where we don't have that that knowledge or that lived expertise. This in turn can improve the quality and the relevance of the research that we do. And of course, you know, I would say that doing PPI is a good thing no matter what, but it's more and more a requirement of those funding bodies that we're applying to get our research funded. So for the NIHR, it's been a long-standing requirement to have done PPI to inform your application and to have plans of what you're going to do if that application is funded. And the MRC launched their public partnership strategy last year, and they're definitely moving in a similar direction to the NIHR. So if we want funding, this is something we're going to have to take hold of. So many statisticians, I'm a statistician by trade, conduct both applied and methodological research, and many of us will be used to talking about PPI in those applied projects that we work on. So those projects that are answering clinical questions and when we're leading the sort of design and analysis of those projects. But what is maybe not so familiar to people is to try and get patients and members of the public involved in that methodological research. So this is where we're trying to drive forwards the methods we use. We're either developing new methods, evaluating methods, comparing methods, and this tends to be more the research that we lead as statisticians. And that very much reflects my journey. I've been sort of involved in the sort of periphery in the PPI that had been conducted for the applied healthcare research I collaborate on. But really, a couple of years back, I submitted a fellowship to undertake some methodology research, and this was really the first time I'd had to undertake PPI myself to inform methodological research. And that was something that I really struggled with. I didn't want to do something for the sake of it. I wanted to do something that was meaningful, that actually made a difference to the research I was planning, but I was really struggling to think about how to go about that. And really, the work that I'm going to present today is a consequence of having tried to undertake some PPI myself. So I knew I was finding this challenging, and many of the researchers in the biostatistics research group at Leicester that I lead are also funded by the NIHR on fellowships. And I sort of knew from the people that I supported with their fellowships, I felt like we were doing enough to get the fellowships funded. And then once we'd got the fellowship funding, the PPI sort of fell away a bit. So I emailed the group and said, this is something I'm struggling with. Is anybody else interested in thinking through how we could do a better job of PPI in our group? And maybe we could help other people do a better job. And actually about 30 people turned up to a meeting. So there was an obvious need, and we sort of brainstormed what the difficulties were we were having, and what the barriers to us undertaking good PPI were. And the things that came out of that meeting are listed on this slide. So we all were concerned about the complexity or the sort of technical nature of the work that we do and how to explain that in a way that's understandable. We all felt inexperienced and had great anxiety about the thought of conducting PPI for our methods work. Some of us had clinical applications for our methods work, and some of us didn't. And for those that didn't, there was questions about, well, who do you approach if you're not working in a particular disease area? There were challenges around funding PPI when you don't have any money yet, so when you're developing a funding application. There were lots of issues around payment. So some members of the group had wanted to do PPI and had looked into how to go about paying people, and there were so many forms and so much bureaucracy they just gave up. So payment was definitely an issue. That's still an issue, but it's getting easier. And really, we all felt like our research was kind of a step removed from direct patient benefit. So would patients and members of the public be interested in what we were doing? And we all wanted to do something that felt worthwhile, not just something for the sake of it, that was very sort of tokenistic in nature. So we decided to conduct a survey, and this was led by Francesca, that now works at King's College, to see if other statisticians felt the same as us. And actually the survey was really enlightening for me. There was definitely sort of two camps of thought that came out of the survey. So there was one group of people who felt like I did. They wanted to do PPI, they wanted to do a good job, but they were nervous about conducting PPI activities and they wanted help to do a better job. But then there was another group of people that felt that actually PPI for statistical methodology research was nonsense. And what could members of the public possibly add to this very technical, complex field? They felt that this was a waste of money. It was sort of a tick box exercise. And they didn't think that patients or members of the public would be able to bring anything to the types of research that they were undertaking. But there was definitely a need for more support, guidance and help in this area. So we decided to form our own PPI group, and we put an advert on the People in Research website, and we were looking for people that had relevant PPI experience in a topic that wasn't too dissimilar from statistical methodology. So we recruited a group of people. We were actually overwhelmed with interest, which I was surprised about. So people are interested in being involved in this type of research. And the people we recruited, one of them has been on the Better Methods for Better Research funding panel. A couple are involved in biobanks or HDR UK, but they all came with sort of relevant skills. And really, they've been teaching us really moving forwards because of the skills that they do have. And we sort of brainstormed what might be useful to develop. One of the things we found was that when we went to a PPI group who were very used to undertaking PPI activities for applied healthcare research, so clinical trials, epidemiological studies, when we came along with our statistical methodology research, it was a bit of a shock to the system, and it was a bit like, oh, this is new, we're not used to helping out with this type of research. And it took them a while to kind of orientate themselves as to understand the type of research we were proposing. So our public contributors suggested that maybe an animation that we could send to people that wanted to get involved before the meeting that described what statistical methodology research was, but also why PPI was important for this type of research would be really useful. So a sort of setting the scene animation. They also suggested that having case studies so people could see what successful or meaningful PPI in this space looks like. And finally, one of our members suggested having a glossary. There are lay glossaries of research terms out there. The NIHR have one, NICE have one, but they don't go very far in terms of statistical terms. So you might get things like clinical trial or odds ratio or mean, but you probably wouldn't get terms like simulation study, bootstrapping, survival analysis, for example. So these were the things we decided to take forward as a group to develop, to not only help us, but maybe help other people as well. So the first thing, as I said, we put together was our animation. And we worked with a company called Nifty Fox to do this, who I have to say were absolutely brilliant. We did try initially to write a script ourselves, and we took this to a PPI group and they just hated it. They absolutely tore it to bits. And it turns out that we weren't very good at describing in a lay way what statistical methodology research is. So with the help of Nifty Fox, who were sort of experts in conveying the complex in accessible ways, we got a really good animation, and the QR code will link through to it. I was going to attempt to play it in this seminar, but I decided that that was definitely something that would lead to failure, because whenever I've tried to play things in an online seminar, it's always gone wrong. So you can watch that in your own time, but I would encourage you, it's there to use it if you're undertaking PPI activities and you want to send some information to those contributors beforehand. It's there freely available for you to use. Next, we wanted to put together some case studies, because our public contributors said, well, this looks great, we really like the animation, but I still can't see what this looks like in practice. And from our survey, statisticians had said that they would like to see case studies as well. So we've started collecting case studies and developing these into animations, which really our intended audience for the animations are public contributors, and then these sort of fact sheets that go alongside them, and the intended audience for those are researchers, but obviously both can access both. So this is animated me talking about the PPI activities that I undertook for my methodological research. So just to give you an example, I was going to be undertaking some work looking at how we design and analyse better trials for those living with multiple long-term conditions. And for part of that work, I was going to be using primary care data to test out some methods. And I was explaining this to a group of people who live with multiple long-term conditions. And one of the members said to me that they like the idea of using existing data, but they can access their primary care records through their phone, and they're all wrong, because they live with multiple conditions. They get treated in lots of different places, different hospitals, different clinics. That data never makes its way back into their records, so their records are always out of date and not up to date with all of this information that's happening in other places beyond their general practice. And that was really eye-opening to me, because it was something I hadn't considered. So it made me really think about the data sets that I was going to be using, and making sure that I had access to other data and to self-reported data that I could supplement that primary care data with. So when you're thinking about how members of the public can inform methodology research, I would say you never know what they might suggest or bring until you try. And I think in our experience at Leicester, it's definitely been sort of wider picture or blind spots that they've picked up on. I don't think it's realistic that someone's going to get really caught up in the nitty-gritty of the methodology per se, but you never know. People come with a whole range of skills, but it does tend to be things you've never thought of and getting you to think out of the box a little bit. So we've also developed a glossary of statistical terms. Again, this is also available on our website. There's about 60 terms. And this was a really interesting process. So we identified the terms by looking at our group fellowship applications and extracting terms that we used in those that it would have been useful to have a lay definition for. And this came to about 60 items. And we actually divvied them up between the team, and we decided as a first go we would use ChatGPT to help us define those terms. So we entered each term and we asked ChatGPT to give us a definition that was suitable for someone with a reading age of less than 10 years old. And we got from ChatGPT lots of definitions. I must say they were quite babyish. They involved a lot of unicorns, cupcakes, fairies. They were obviously trying to use analogies, but the analogies that they'd chosen, I think because we'd put less than 10 years, were sort of on the childish side. So we decided we weren't particularly happy with those definitions, and actually it would be much better to try and do fewer to start with and do them in a more robust way. So our PPI group helped us. We presented them with 10 definitions and we gave them 3 different versions. So one was based on the ChatGPT definition, but with the sort of fairies and cupcakes removed. One was a plain English definition and one that was aimed at statisticians. And what we found actually was that our PPI group, they really appreciated those that had come from ChatGPT, the ones for a reading age of less than 10 years. So we took those forward and we really worked with our PPI group on those definitions. We got to a point where we had a list of definitions, but as our PPI group said, there's only so lay some of them are ever going to be if you want something that's just a few sentences long. So we're now working with an illustrator to put together some illustrations that can go with the list of definitions to help explain what they mean. So you can see an example here of one that's been developed for Bayesian. So the PPI that we've undertaken so far with our PPI-SMART group has been great, but we're very aware that while they're diverse in their characteristics, they're not very diverse in their experiences, because I would say that they're all highly experienced public contributors. They all come, and purposefully so, we recruited people that had experience of conducting PPI activities in relevant areas. And so we're aware that actually that's not a very diverse voice, and maybe we need to be engaging more diverse groups of people. So we've started some community engagement activities. Craft by Numbers is what these activities are called. And what we do is we visit a local community group. We introduce them to a craft, and this is called iris folding, this sort of sticking bits of paper to card. You follow numbers, which is where the numbers come in. But while undertaking the craft activity, we get chatting to people about what we do, that PPI is a thing, that members of the public can get involved in the types of research we do. And I would say it's almost like pre-PPI. These people, the groups that we're going to visit, they've not undertaken public involvement before. So it's really about building relations within our local community, getting people to understand that statisticians undertake research that contributes to the way that they're treated, and that they can get involved if they were interested in getting involved. It also gives something back to our local community, and it develops our communication skills. So it's been really eye-opening and a very steep learning curve for us all, but something that we're very much enjoying doing. And hopefully then when we need public contributors in terms of maybe developing a grant application, we can go back to these groups and say, would anybody be interested in helping? We've also just launched with a group of people from across many organisations, there's about 10 of us in the organising committee, a community of practice for PPI for statisticians. There's lots of pockets of research going on, and there's a growing literature where people have undertaken PPI activities for statistical methodology and then published their work. But there's no kind of one place where you can easily find those resources. So we wanted to develop a space where people could learn from others, share their experiences, share things that they had developed that had worked well within their groups. So I would encourage you to join our mailing list, and we've got a LinkedIn space as well. We're going to be holding seminars, roughly 6 a year. They're sort of every other month. The first one is on Tuesday, the 1st of April. But these are on a complete range of topics. So we've got one on involving PPI in electronic health record research. There's one on evidence synthesis, one on early phase trials, one on setting up a methodology PPI panel, and one on machine learning. So a whole host of different speakers. So I would encourage you to engage and to sign up and to be part of this community, and hopefully we can all learn from each other, because even though at Leicester we've been developing these resources, I would say we're still learning what works well and what doesn't work well in terms of trying to do PPI in this area. So coming to an end now, my kind of top tips. I would encourage you to try and make PPI part of your day job. Before we started doing this work, I only did PPI when I needed to inform a grant application. And that's a very anxious time anyway, when you're putting a fellowship or an grant application together. And then you throw in doing PPI on top of this, and no wonder you feel anxious about doing it. I think if it's something that you do on a regular-ish basis, it becomes, you get more used to it and you become less anxious about undertaking these activities. I would say that in the UK, we're really lucky that there's lots of existing infrastructure that can help. So at Leicester, we have a BRC, a biomedical research centre, and people are, there's a whole PPI team that is funded. So they're really great. They're experts in undertaking PPI, not necessarily in statistical methodology, but they can really help identify groups. Someone came along to my meeting to help chair the meeting. That really helped, because it's really difficult, particularly online, if you're trying to chair, you're trying to note down what everyone's saying, you're trying to give everyone the opportunity to speak. It can be really difficult to capture all that and to manage the meeting. So if you've got someone else who can sort of do those logistical elements for you, that can really help. And they are expert in managing a group, because some of us had been in meetings before where maybe there'd be one person that'd be particularly vocal, and we would find it really difficult to try and draw that person to an end and let other people speak. And that just takes away those worries, because people that are used to doing PPI are really great at managing these group situations. We've started shadowing meetings at Leicester, so even if it's PPI for an applied research project like a clinical trial or developing a risk score, whatever it might be, just seeing how the meetings are run, what happens within a meeting can be really helpful to take some of the mystique away, because we found that many people in the biostats group had never been involved in PPI before they needed to do it themselves. So I think that's really helpful. I would really encourage taking up sort of outreach or community engagement opportunities. It's actually just quite nice to do something that's a bit of a break from the norm. I quite enjoy going to a group, chatting to people, undertaking some craft, you know, Pritt sticks and bits of paper. Gluing and sticking isn't something I do on a day-to-day basis, so I actually quite enjoy getting out of the office, and it's quite nice to do something creative as well. Now, one of the things I really worried about when I was undertaking PPI was worrying about how public contributors might contribute to my project, and what how they might be able to get involved. And one of the people I was talking to, they said, well, that's not your problem. You know, that's what we're here for. Your problem is describing your project to us in a way that we can understand, and then let us tell you how we can contribute. And our PPI-SMART group, we've run lots of different projects by them now, and they've always been able to contribute something in some way, shape or another. They did think that they may struggle. For example, some people in our group develop R code, develop new software packages, and they thought that they might struggle to meaningfully contribute to that type of project. But they said that PPI was always worthwhile because you've still had the opportunity then of talking about your work in an accessible way. So that's still important, and that they could still advise on things like dissemination, for example. So I think it's not assuming that members of the public can't help. It's giving them the opportunity to, and then you being guided by them and what they suggest. So that's the end of my talk. I really like this quote that one of the public contributors that I work with said, and I keep quoting it because I think that actually methodological research is really important and is really key to improving outcomes for patients and members of the public. So it was nice to hear that they did too. I'm more than happy to take any questions people might have, or to share further experiences if you want to ask about them. So thank you.
Thanks very much, Laura. That was really great, and so many points I could comment on. The top tips especially, I think, are really helpful, especially for those of us who might not be as experienced. I know I ran a PPIE group for the first time late last year, and I can definitely vouch for this idea of take a support crew with you, so it's not all on you to chair the discussion, make the notes, keep an eye on participants who are taking over the conversation.
Yeah,
it's great. And also the idea of just turning up to sessions as an observer, if you can find a group who's happy to have you, it's a great idea, because it's a no pressure situation where you could just observe how people are approaching it. It's really good. I'm just looking to see if there are any questions from the audience. Okay, nothing as yet, but do stick your hand up if you have something. I had one question. I thought it was interesting how there was quite different kinds of responses to your survey that you mentioned at the start, where there were some people, there was kind of different camps, and one camp was quite negative and like, well, I really don't see the point of this, it's too hard. Were you able to kind of revisit these kinds of people with these kinds of views later, or?
Yeah, well, it's interesting because there was someone, I'd shared the link to the survey on Twitter, X, whichever it was at the time, and someone had retweeted it saying something very, they were saying, this is how ridiculous, what, PPI for statistical methodology, what a load of rubbish kind of thing, and retweeted it, and it caused a bit of a Twitter storm. And we actually went to the NIHR Statistics conference, and Francesca, who now works at King's College London, she gave a presentation on our survey and showed these tweets. And actually, the person that had sent the first tweet was actually in the audience, which was really interesting. And they said they were trying to cause a discussion because it is an interesting topic. And quite a lot of people say to me, oh, well, surely we should be talking to statisticians because they're the users, they're the end users of the work we're developing. And I would say that both are important. So, for example, if you're a GP and you're doing research into a new decision tool to be used in primary care, of course you would go and talk to people within primary care, but they're stakeholders. They're they're your end users. It's not PPI. PPI is a different thing. So I would say that both of those things are important and are things you should do. And I think we did sort of persuade the person that gave the first tweet that, you know, this was something that was important and was worthwhile doing. So hopefully with changing minds, and as people have a go, I think you never know what will come of it until you try.
Yeah, it's not quite always so obvious.
Yeah.
That's interesting. Saskia, you've got your hand up there. Do you want to go ahead with your question?
Thank you. Thanks, Laura. It was really interesting and great presentation. Really great work, and obviously really needed. My question was around whether you've connected with teams that are from the social and behavioural sciences who do qualitative research, and the reason I asked that is because I've been thinking about this for a while. I come from a quantitative and qualitative research background in psychology applied to genomics and now data science and mental health. And and I also worked on PPIE strategy and delivery at Our Future Health. And so I've been thinking about this for a while about there are clearly overlaps between PPIE methodologies and obviously qualitative research. For example, focus groups. And so both the examples that both you and Jude both brought up around, there's somebody very chatty in a group of 8, 10, 12 people. How do you manage that? These are exactly the kinds of things. Or how do you draw people out? How do you make sure that there's equal contribution between people within that sort of dynamic? These are the things that social and behavioural scientists have been, trained, to do and to manage and to facilitate. So, and others as well. So there's that focus group facilitation skill set. I just wondered how much your group is sort of interested in and has sort of branched out and overlapped with those groups, because I think there's something really good that we could be doing here across the two areas and join those dots up.
Yeah, no, that's a really interesting point around the skill sets required for PPI and for qualitative methodologies. We have just got, I didn't mention it in the talk, I don't know if it's allowed to be public yet, but we have a grant funded which is looking to develop guidance for undertaking PPI for statistical methodology research. And actually all the research that we're going to do to inform the guidance is qualitative in nature, which is really interesting. So we will be working with qualitative methodologists, but I haven't spoken to them about those skills that they have that might be really useful for us. So that's a really interesting point. I have spoken to people. We have an empathy centre at Leicester, and one thing that has come up is people being worried about when they're speaking to groups of patients, and we do a lot on survival. And if you're working in the cancer space and you're going to talk to a group about survival methods, for example, that might bring up emotions, or people might mention things that you find difficult to deal with as a statistician. We're not clinicians, we're not. So the Empathy Centre at Leicester, we have been having some discussions with them around some training about how we deal with those sort of things when they come up, because that is something that people have said that they're worried about, not knowing how to deal with when it happens in the moment. So yeah, that's a really interesting point and definitely something I'll take away.
Would it be okay if I just ask a follow-up question to that?
Yeah.
Thank you. Yeah, I completely agree with everything you just said, and I think that's exactly where my head is going as well. It's around the training, how to facilitate group sessions of people doing this. And actually, I think increasingly, I actually think that this is really important, because if you're going to take responsibility for people have come together, they've come to discuss something possibly quite sensitive for them, there's the group dynamics to manage and so on. I think actually, if you're going to facilitate that group discussion, it's probably really important that you have got that training and that sort of confidence, or that this is a direction for of travel, that we increasingly start thinking about how to put together that training as well as guidance. So yeah, I agree with all of that. Thank you. And then building on that, you mentioned the patient groups who have who living with cancer. And here, of course, we're really interested in and focus on people with mental health issues, and it can be, you know, serious mental illness. And again, I think there's some real risks in this area, in particular, bringing together groups of people. And I think maybe this is a blocker. It's stopping people doing the PPIE sometimes, because if you've got if you're bringing together a group of people who maybe either, you know, have serious mental illness, you do have a responsibility to sort of manage that setting quite carefully, and either we do that. And so I just think there's another, I suppose a question around that is, again, have you, to what extent are you in your group getting into the opportunities and challenges for PPIE in stats that are the same across areas and consistent, and that you'll always want to address and think about, and where there are differences in the challenges and opportunities depending on the nature of the topic you might be in a more applied end be addressing, and therefore the patient groups that you might be talking to.
Yeah, so I guess we've tried to focus on the things that are different between undertaking PPI for stats methodology and undertaking PPI for an applied study. So some of those issues around you know, the groups that you're accessing and your duty of care and those sort of things, I think are common across whatever you're going to talk to the group about. But I think it is really important, I think, to consider who you're speaking to, whether there are, you know, whether you should be taking someone along with you who, for example, has experience within that group. You know, it almost just seems, from my experience, that as statisticians, we just sort of turn up to a group, and, you know, our training experience is our first go at doing it, and it sort of can very easily go wrong. And as you've said, there are lots of things at play here that might go awry, and I just think that's something we need to try and change. And I think training is definitely a big part of that, because I don't think there is training. We did do a workshop. We got some funding from the NIHR a year ago now, and we only had 80 spaces, and we were inundated in people wanting to attend. So there is definitely, I think, a need, and we didn't cover within that day some of the things that you've highlighted there. So there's definitely a lot more to be done in this space. So yeah, thank you.
Thank you. Thanks.
Great question, great answer. We've got 2 questions in the chat that have come up. The first is from Samantha, and she said she would like to ask about identifying a group or community to involve for projects that are not directly related to a single clinical trial or clinical area. So she says, for example, my work is looking into research uses for electronic health records, and I'm not sure who I would need to include for PPI. Is this a question you've grappled with, Laura?
Yeah, so this has come up. So some of our researchers in the biostats unit, they work on methods to inform cancer clinical trials, or, you know, whatever it is. And there's an obvious clinical group that you could go and, you know, and you could contact. But when you're working more generically on methods that aren't about a particular clinical topic, you know, it's a methodology, it can be really difficult to know who to speak to. So, I mean, I think I would try and see what groups already exist, because it might be that there are some more sort of generic PPI groups that already exist within your institution. So, for example, we have at Leicester a group, an older people's group, PPI group, and they've all got, you know, they're not there because they've got a particular condition. So yeah, see what already exists. I think the People in Research website is really useful for recruiting people, but I would be really make sure you're really explicit about what the research is about, because in my experience, you do tend to get sort of inundated.
Okay.
With people wanting to be involved, but I would see what groups already exist that aren't focused on a particular disease, for example, and if not, try and use the People in Research website.
Great. Sorry, is that an NIHR website?
Yes.
Yeah. Great. Awesome. And the second question is from Eileen, and she said that was really informative. Thank you. And she was just wondering what stage of your career you were at when you started this project.
Really late. So much to my embarrassment. So the fellowship I spoke about was for the NIHR Research Professor Award. And that was the first time that I was undertaking PPI myself for my own personal fellowship application development.
Mm-hmm.
I'd never had a fellowship previously, wish I had. They're like, I work with lots of people who have fellowships, and they're really, career goal to get a fellowship. But I would say I wish I had started earlier. PPI has definitely evolved. It wasn't something that was even discussed when I started my career. So maybe that's a reflection that I'm a bit old now. But yeah, I think I would have preferred to have started earlier. And for example, the pre-doc fellowship scheme, I chair the panel, it's open at the moment for applications. You get funding within that £1,000 for PPI, which is great, because I think if you can start these things earlier, all the better, because it's a lot less scary, I think, then as well.
For sure. I think there's two lessons there, that it's okay if you're more senior and you just haven't had the opportunity. You can start anytime, but also if you're early in your career, do keep an eye out for opportunities to get involved. Yeah, so I think that is, okay. Yep, it's a comment, not a question, but Andrew is saying there's a workshop in June at the MRC Biostatistics Unit, Cambridge University, on adaptive and Bayesian designs, focus on patient perspectives as well as statisticians and clinicians. So Andrew is due to give a talk on writing lay summaries. Oh, yeah, he's asking if you can share a link to the workshop. Please do, Andrew. Yeah, go ahead. I'm sure everyone would love to see that. So this presentation is being recorded, and it will be posted on the sort of webinar series website, so people can always access it. And if you know someone who's interested who couldn't make it today, please do share with them. But I think that's all, unless anyone has another question.
There's the link in the chat, so that's great. Thank you, Andrew.
Yeah. Okay, so I think that's us. But yep, thanks to everyone for joining us, and thanks very much, Laura. Yeah, really interesting talk.
Thank you for having me. And yeah, great.
Okie doke. I think that was really lovely. We got over 80 people, 85 people came to your talk.
Wow.
That's awesome. Really good. That's a big turnout. So
thank you.
Yeah. All right. Take care.
Bye.
Thanks a lot. Bye.